Hey everyone. I am back with Ruthie Kalai. If you are a regular listener, you may remember her from episode 102, where she talked about body dysmorphia. And she is a licensed clinical social worker with over 20 years of experience working with children, adolescents, and adults. She's particularly interested in working with people in their 20s and 30s. And why is she here? Well, we have developed a friendship since she appeared on the podcast, and I thought she would make a great guest for something I've been wanting to do for a while, an episode that I think I'm going to title Two Therapists Chatting. And this podcast episode is about what goes on in our minds as we're doing the work, what are some of our experiences have been, which is kind of the whole purpose of the podcast as a whole. And one of my favorite episodes is, I forget the number, but it's titled When the Therapist Makes You Squirm. And it really holds true to the purpose of this podcast, which is what are we dealing with as therapists as we're moving through the work? So I thought it would really be fun just to have a conversation, see what comes up about some of our firsts, how we actually feel in sessions. If we ever feel that we're actually not helping, who do we like working with? Who do we not like working with? Let's see what comes up. So, hi, Ruthie.
Hi, Amy. Thanks for having me again. It's really nice to be back.
So great to have you.
hmm
All right, let's get into it. So I know, over the years of a 30-year career, you with over 20 years of doing this work, there's a lot of processing, emoting, feeling, self-doubt, great moments, satisfying moments, all over the place, right?
And that's only like that can happen within 5 minutes.
Yeah,
Sorry.
that
I
can
just,
happen.
yeah,
That's
yeah.
true, right? That
Uh-huh.
can happen all within 5 minutes of being with
hmm
a client, right? Or afterwards.
hmm
And one of the things that actually I've been thinking about a lot lately is where I started and how much I have grown. And one of the things I've always talked about is what a luxury it is, not only growing professionally, but personally as we do this work. And I feel really proud of who I am now because for a long time I didn't like myself. And I felt like doing this work also makes it really hard, especially at the beginning, when you feel like you're messing up all the time, or you're not saying the right things, or you're having clients who just trigger all your stuff,
hmm
and you haven't worked it out yet. So
hmm
now, one would hope after 30 years, I've worked a lot of it out. And so I don't get as caught up or emotionally responsive, right, to what clients say or do. But I was thinking back to some real humdingers. I
hmm
don't know. I don't
Of
know if you have any
course.
of those
Many
experience past or current. It's not like
current.
they never go away. But do you have any thoughts you want to start us off with?
Sure. I mean, yeah, like, and as I'm listening to you talk, I'm realizing that I had kind of two separate imposter syndrome phases of my career, like that initial you don't know what you're doing because, there was the first initial phase of my career, which was when I finished school and got my first job and was kind of getting my feet wet. And then 15 years later, there was the private practice beginning, right? So, and that was weird because I had spent 15 years working through the feelings of not being good enough and not knowing what I was doing and, really getting to a place where I felt super confident in my role. I was a school social worker. I had wonderful rapport with the kids that I worked with, and then completely doing a 180 and finding myself in private practice having to find those skills that were really rusty because working with kids is very different than in a school setting is very
Yeah,
different than working in private practice.
right.
And I was virtual, so all of a sudden 15 years down the road I'm finding myself completely as a newbie, and having to go through those feelings. So, like, that was very unexpected and challenging.
hmm right. So it was almost like a second coming
Yeah.
of all
Yeah.
those difficult
Yeah.
feelings, right? And am I good enough? Am I doing well by my clients? It's interesting. I feel like as I have progressed with private practice, and it's now kind of my secondary work. I'm much more selective about who I work with. And so I think that that kind of helps to
Mm-hmm.
offset, the really challenging or the ones that keep you up at night, those kind of cases. On the other hand, you never know when that's going to come up anyway.
Mm-hmm.
But I always think this one client resonates for me when I was really, really young at this, and young in career and young in age, to work with a client who was so traumatized, so damaged by his early childhood that he was incredibly abusive. And I don't know if it's necessary to go into the details of his past, and I don't know if I remember all of them, truthfully, but I remember being with him and how challenging it was to have somebody every single time I met with him tell me how inadequate I was.
Wow.
And there was one, I mean, this is kind of crazy, but I guess I'll just lay it all out there. I mean, there were times where he would call me and scream at me just in regard to something I had said the private session the previous session.
Mm-hmm.
And then we would, of course I would say, well, we'll talk about it when you come in. But during one of these phone calls, I had made the mistake of pouring myself some water, and he asked me if I was peeing.
Oh
And
my God.
right. And there is no right answer with him, right? So he's just so furious. He doesn't believe me when I say I was pouring myself a drink of water, but I shouldn't have been multitasking at that moment, especially with somebody like him who was so in need of constant attunement. And that
Mm.
need for constant attunement played out in one session with him. I remember when he brought in a picture. He brought in a magazine, and there was a picture of a woman on the cover of the magazine, and he plopped it on my desk in front of me, and he said, "What do you see?" I shouldn't say he said, he demanded, what do you see? And at that point, right, all I'm taught or trained is get to what he is trying to explore.
Mm-hmm.
But he
Right.
was somebody with who that infuriated even more for me to say, well, what do you want me to see? Or what do you see? Right.
Right. Right.
I felt very caught. And again, at that young stage of not really knowing or having enough experience how you handle, one, this type of client, but two, this type of moment. So I think I bumbled my way through it and said, I don't know, what do you see? And he said, you tell me what you see. So I said, a woman. And he said, and obviously that was the wrong answer, but it was a woman. There was nothing like out of the ordinary about her. And he yelled at me and he said, it's Psych 101, like, you dumb fuck,
Right.
basically, right? You dumb, and I just was undone because of my own history of being spoken to a certain
Yeah.
way and being, really kind of treated in that way. And I often think about what would I do now,
Mm-hmm.
if that same kind of client handled me that way. Um,
What
so
would you do now?
yeah, well, I was thinking about that. What I was going to say, then thought I'd better have an answer. What would I do right now?
Well, actually, wait, before you answer that question,
Yeah.
here's a even earlier question. Do you think you would have taken him on in the
Mm.
beginning? Initially, like, even would you have even taken him on as a client? I don't know how thorough of a consultation you do initially, but like, would you have even gotten a vibe from him that, like, oh, this is somebody I don't want to work with? There's
I think
something
that
not
that's an
right.
excellent question, but I'll tell you, early on, it felt like everything was a learning experience.
Mm,
And as I tell my students now, like, you have to work through the discomfort. And if you're going to grow, right? Because you're going to learn from each and every one of them. And even when the countertransference is high, if you feel like you can't handle the countertransference because, say, somebody is presenting to you with a chronic or fatal uh, illness or disease, and you've just lost somebody very close to you
mm-hmm,
to that disease, and you haven't worked it through yet. I mean, then you might have to
mm-hmm,
think that through. But I don't know if I was aware enough to even know that this was touching something so familiar. I knew I didn't like it. I knew, I didn't really know how to deal with him, but I knew I had to seek supervision, and that was, what you do. Right. So, yeah, I don't think
yeah.
the thought occurred to me of I have to get rid of him or he's not right. It's not a good fit for me.
Mm-hmm. Yeah. I think that's that recognizing how to discern if somebody is right for you is such a big piece. But like, I don't know how one learns that without having those types of experiences, because especially when you're starting out, you want to, you just want to take everybody, you want to, you don't want to say no, you don't even know what you need and what you don't need,
Right.
or what works for you and what doesn't work for you. And so, yeah, I mean, I think that's a really key thing, is to be able to recognize, you know what, there's something off. Like, there's something that's making me feel uncomfortable with this person. I don't think I'm the best fit. And
Right.
I think that's a real strength, to learn to be able to say, I don't think I'm a good fit for this person. Um, for me at least.
Yeah, no, I think by the time I realized that, I felt like it would have been such an abandonment to him
Mm,
that I felt I had to do the work on me personally and professionally in order to uh, figuratively hold him, right?
hmm. Yeah.
But yeah, you have to know your limits. You
Yeah.
have to know what you're capable of. I mean, there's many times I'm working with people, even in my later years, that I felt like, am I helping this person? So is it me or is it them? And do I need to refer them to somebody who may have a more of an expertise in this area, or do I need to get more supervision in
Hmm.
working with them? But it's an important question. So I just
Yeah.
want to answer and then I want to turn to you. I want
Okay.
to answer what would I do now? I think now I set limits. I'm not going to be spoken to a certain way. You're allowed to be as angry as you want, but you can't be abusive, right?
Hmm.
So, and we can understand what that's about and what's really going on here and all of that, but you don't get to abuse me
Hmm.
as we're doing the work.
Hmm. Yeah, absolutely. Good. Yeah.
Did you have a most difficult client and know why they were difficult for you?
I've had the difficult clients I've had were not so overtly difficult. Like, I don't think I've ever had anyone who was, who spoke to me that way, or who was just in my face angry. It was more of, people with this desperation for me to fix the problem, and looking towards me as if it's my responsibility. And why aren't you helping me? Like, I'm thinking of this one woman, and fortunately, there haven't been a lot of instances, but I had this one woman that I worked with that she just would get angry at me because she's like, you're not helping me. You're not telling me what to do. And she couldn't understand that my role was to not tell her what to do. My role was to help her figure out what to do. And again, it's like that, playing like this, your client was playing out his stuff in the relationship with you.
Hmm.
She was playing out her helplessness with me, because that's how she felt in her life, right? She felt she was just this helpless being flailing. And she was acting it out with me.
Hmm.
And, I eventually had to get to the point where I just said, maybe I'm not the right person for you. And not in a hostile way or an aggressive way,
Right,
but after
right.
explaining to her, like, my role isn't to tell you what to do. And maybe I'm not the best fit for you. So for me, I've had a lot of those people who just come to, they have such an intense anxiety, and they're just looking to me to fix it and to solve the problem. I remember I had this one person who, prior to our first session, sent me about a 7 or 8 page Google Doc, with his whole history. He's like early years, teenage years, early, and it just went on and on and on. And I immediately got this feeling like, oh, I don't know about, I don't know how this is going to fit, but again, the same thing, this just palpable anxiety of like, you need to fix and solve all my problems and make me feel better.
So I have a couple questions about that.
Yeah.
One is, do you ever interpret that to these kinds of clients? Interpret the transference, what is being projected onto you?
You know, I haven't, I feel like that's really hard for me. And actually, I'm in a peer supervision group now. And sometimes when I'm talking about a challenging case, that is often the feedback I get, of like saying something to the extent of, wow, I noticed that our relationship is similar. You're kind of repeating some of the same dynamics with me. Or what does it feel like for me to be pushing you when it's hard to, when you struggle with being pushed.
Mm-hmm.
It's for some reason it's uncomfortable for me. I think I obviously, like a lot of us, don't like it, feels confrontational.
Mm-hmm.
And I still want them to like me.
Mm-hmm.
And I want it to be a positive experience, even though intellectually and clinically I know that that could really be a positive experience eventually.
Mm-hmm.
So it's something I struggle with. It's a skill that I'm trying to improve, but it's hard to
Well, that's
kind of,
honest.
yeah.
I don't think you're alone in that feeling, right?
No,
I
definitely am
have
not.
actually a very brief podcast on confrontation. And I think that actually a lot of what we do in therapy is confronting very gently. But if we
Mm-hmm.
don't confront, then how does somebody understand why they're doing what they're doing or feeling what they're feeling and, learning how they move through their life,
Yeah,
which isn't always just, full of validation and support, right? We have to kind of use what's happening between us and the client to be able to address that. So,
yeah.
yeah, really important to
It
to
is,
learn
and
how to do
it's
that,
definitely a
right?
skill that I'm working on improving, because I know that it could be really helpful and therapeutic.
Right.
But I find
Right.
it to be really challenging for
Yeah,
me.
totally. That's
Mm-hmm.
countertransference.
I
Um,
know, it's no joke.
it's no it's no joke. But it's funny because I actually have a client of recent who also does that, but doesn't vocalize it. So something comes up in me where I'm always saying to him, this is going to take a long time. It's going to take time to unfold. And I hear myself, and in the moment, I know that I'm doing it, but I can't stop myself from doing it because it feels like there's this expectation,
Mm-hmm.
fix it, fix
Mm-hmm.
these obsessive thoughts I'm having, and I can't, right?
Mm-hmm.
And I don't know
Yeah.
how, and I don't know if I ever will know how, because I think that those clients are really challenging to work with
Mm-hmm.
and break through that. But yeah, there's that pressure to perform,
Right.
which I'm
To make it all
noticing
better.
is a new
Yeah.
countertransference for me because I don't
Yeah.
like it.
Yeah. No, I think that was something that I struggled with early on, was just like, it's my job to fix their problems,
Hmm.
or to make them better.
Hmm.
And kind of like what I said to this woman who was frustrated with me that I wasn't telling her what to do. It took me a while to realize, like, no, my job isn't to fix the problem. My job is to, help them fix their problem, help them understand what's getting in the way, help teach them the tools that they need to kind of get out of the situation that they're in. and
Right.
and boy, was that helpful to realize, because that's immense pressure to walk around with all the time, to think like, oh my god, this weight is on my shoulder, like I have to help all of these people fix their problems.
Well, yeah, and on the other side, it's kind of magical thinking. Like, who are we,
Yeah, who are we? Right,
right? Like
I'm
these
not that
powerful
powerful.
gods to wave
Mm-hmm.
our wand and say, take this from you. But at the same time, I understand, and I'm sure you do too, the feeling in clients, having been a client, right, of
Mm-hmm.
wanting someone to just make it better,
Make it
right? It's
better.
like going
Yeah.
to a medical doctor, when
Mm-hmm.
you're kind of disappointed, when you've been feeling some kind of ailment, and they tell you, there's really nothing wrong. We've taken your blood
Right.
tests and did it. And like, no, no, tell me what's wrong so I can fix it, or you
Right.
can fix it with some medication, right?
Right.
So in this, scenario, where the medication, where the fix me.
Yeah, very challenging.
Yeah, yeah, it is. You have any pet peeves?
Oh gosh. uh, I guess I would say, well, currently, I'm thinking of just kind of currently what I'm dealing with. People who don't respect my time, meaning they show up late chronically, or they cancel at the last minute, or I have this one person who, consistently kind of shows up on a New York City bus, or, walking from her apartment to get a pizza or something like that. And we've talked about it, and she's adamant that she's focused, she's present. So things like that. But I would say, the people who just continue to stay stuck, and I'm I'm even hesitant to say that because I know being stuck is part of the process. And I
Mhm.
myself, in my own personal life, oh, there's been so many times where I've been stuck, and I'm sure I sound like a broken record to my therapist. But I struggle with that. I really do, especially when I'm kind of psychoeducating them on things that they can do and giving suggestions and, talking about, like, they're clearly complaining about something, but yet the ability to do the work is just not there yet. And so I try to be patient and I try to understand that that's part of the process, but that frustrates me. That's a pet peeve of mine.
Yeah, I agree. I mean, like, there's an
Mm-hmm.
intellectual understanding that change takes time, but
Right.
sitting with it is sometimes really, really hard. And not that I think we're both saying the same thing or thinking the same thing. It's not that we don't expect therapy to take a long time, and we can be very patient with that. It's a particular client, I think, that you're talking about that just kind of cycles over and over and over and kind of um, stays stuck because getting unstuck is too threatening in some way.
Mm-hmm.
And
Mm-hmm.
so the stuckness, which drives all people into therapy. So I know you are open to that. We're open to that,
Yeah.
even though it can be frustrating. Is there's a different, for me, there's a difference with somebody who is insightful, right? And can kind of do the work and reflect versus the person who's perseverating on the
Mm-hmm.
same thing, and any suggestion that you offer is not going to work. I don't know if that's what you're
Mm-hmm.
talking about, but
Mm-hmm.
that's what it
Yeah.
reminds me, right?
I,
It's not going to work. Oh, no, that's and dismissing it before there's even room for it to breathe.
right. That, but also not even bothering to even consider that it won't work. Like, I'm thinking of almost as if, why am I doing more work than they are?
Mm-hmm.
Kind of like,
Mm-hmm.
wait, I'm way more invested in this. I'm doing way more work than they are.
Mm-hmm.
Yes, same intellectually, that that's part of the process, but sometimes it's really frustrating, and I those are the sessions that I dread. I
Yeah.
really do. Like, I'm like, oh, I have to have the same conversation over again.
Yeah.
And having it go in circles.
Right. It's
When
the
I
going in
know
circles.
it's the
Listeners, I
going
just
in
want you to
circles.
know it's the going
Right.
in circles. Everybody has to repeat things over and over. And like, so tell me about what happened again when you blah, 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 blah. We need to hear that oftentimes repetitively,
Mm-hmm.
and you need to process it as the client. That's not what's being said right now. So we don't want
Yeah.
to turn people completely off to therapy or make them really anxious and scared. Oh my God, is my therapist thinking this or that? This is Amy and Ruthie talking,
Yeah.
period. These are the
Yeah.
things that just
This
kind
is
of
the human side. This is the I can't
yeah,
help but let this affect me side. It's not the
right,
clinical piece. And
right.
it's not like all the time. For example, you always work with those people, let's say, who are in and out of a relationship, right? And like, break up, get back together, break up, get back. I'm not referring to that because I feel like each time you get back together, you're trying to do something different, right? You're trying to make it better. You're doing the footwork. It's more of the people who don't even want to bother to do the footwork,
Mm-hmm.
even like one minute tiny little step,
Mm-hmm.
like that can be
Mm-hmm.
frustrating because that they can feel better. You've witnessed it. You know the power of this process, and yet, for whatever reason, it's too scary, it's too overwhelming, they're stuck, they can't
Right.
do it.
And I think that it's important to interpret that. And I think, that's a confrontation, right? Or I
Mm-hmm.
often say, if I'm working harder than the client, something's wrong, right? If
Right.
I'm working harder than my students, something's wrong, right?
Mm-hmm.
So that has to be brought up. I tell it to my students and I tell it to my clients.
Mm-hmm.
Something seems a little off here. I'm very invested in helping you, da, 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 but it feels like the wheels are spinning. It's a
Mm-hmm.
confrontation. And let me tell you that I was very, very confrontation averse. I just don't think it has
Mm-hmm.
to be what we tend to think about it as mean and ugly. It's not,
Right.
and that's our association to it, right?
Right.
That it's
That has,
aggressive or
yeah.
assertive or,
Well, just the
yeah,
word has a negative connotation. You
yeah.
say confrontational or, confront somebody, it has a
Hmm.
negative connotation. But
Hmm.
you're right. It absolutely doesn't have to be. And in fact, sometimes that's the push you need.
Hmm.
I had my own experience once in many years ago in therapy where, a therapist confronted me, and it was so powerful. So powerful. Like 20 years later, I still remember it was such a turning point for me, but she took a chance. She
Wow.
took a chance by saying something and I was in a very vulnerable state. But it was powerful.
Interesting, right?
Mm-hmm.
Yeah.
Yeah. Yeah.
Um, and very curious. But I want to go back to something you said about
Mm-hmm.
wasting your time when somebody is late um, or was late or did what? Something else.
Or shows up like, doesn't like shows up in public, not in a private space, because I'm 100% virtual. So sometimes people show up. This one person I'm thinking of will show up, very random places that are never private.
Oh, really?
Yeah.
So, but did they know that you're going to be there?
Yeah. No. Yeah.
Oh,
Yeah.
well, that's a whole different
Yeah.
story. But
Yeah.
I've learned like when they're coming late to therapy, because I also, it's funny how many things we have in common about
Yeah.
our perception. I've like in real world, I'm always on time, if not early, right? I never
Same.
want somebody to have to wait for me. So I value other people's time. So yes, you would like that
Mm-hmm.
reciprocated. What I've learned about clients though, is if you're late, this is your time as a client.
Right.
You're not wasting my time. You're not, disrespecting my time. You're disrespecting your own time.
Mm-hmm.
And what is that about? And what does that
Yeah.
mean? And what's the resistance, if there's any, to the therapy, right?
Yeah.
Or taking control, or right, trying to balance the power differential. There's so many potential meanings to it. But that's just an example, your reaction of, again, like that we think when we go into this field, it's about the other person, the other person, the other person. No, it's about the both of us.
Mm-hmm.
Because we have to manage all these feelings and understand them so that we don't take them out and personalize them and
Right.
take them out on our clients.
Right.
Right?
Right. What are your pet peeves?
Yeah, I don't know. I never thought about it until you just said that. I mean, I asked you about it, but my pet peeves. I mean, one, I don't want to be talked to in a certain
Mm-hmm.
way. But it's kind of the same thing. I feel like I'm aligning with you.
Yeah.
The client who's just going, who also along those lines, I guess, is the one who doesn't let you in. They're so
Mm.
anxious. I have a hard time holding other people's anxiety when it's incredibly intense. I mean,
Mm-hmm.
work with a lot of anxious people, but when it's so palpable and they're
Mm-hmm.
so anxious that they can't even let you speak,
Mm-hmm.
it's like, I mean, that's something I've worked on my entire life, is finding my voice. So to have to do it in the therapy session where I believe it's my client's time to do with it what they
Right.
like, but what is the purpose? Once in a while, I think, what's the purpose if I can never get a word in, right?
Right. I'm curious if what was your process like when you realized, like, how did it occur to you that you are picking up and feeling their anxiety?
Oh, I mean, I could feel it in my body. I can
Mm-hmm.
feel it in my, wanting the session to be over.
Yeah.
And just, you just feel the frustration.
Yeah.
It's not something that's subtle. So,
Yeah.
I was like, what is subtle is when like people feel bored in a session maybe, and they don't understand why that is. And I have kind of learned along the way, it a lot has to do with the client who's repressing their feelings.
Mm-hmm.
Um, uh, and that to me is important. I want to feel connected. I want to feel, that we are engaged.
That we're
So,
doing something meaningful.
yeah.
Yeah.
And then we're in relation to, right,
Mm-hmm.
the other person. So when that's not vibing, I think
Yeah.
that can be challenging.
I know it was really key. Like it was very momentous for me when I realized that I was really feeling their anxiety. I think it took me a while, um, especially because, I'm on screen. And so it feels like, how could it's almost like contagious, you know?
Yeah.
Um, but it helped me so tremendously when I start to notice I'm feeling their anxiety and calming myself down in the session is so then it transfers over to them. But that was such an important piece, such an important thing that I learned. It took me a while to learn it, but because it's really contagious,
Yeah. Yeah.
those feelings or the
See,
feelings of boredom.
yeah. So we can see
Hmm.
how challenging this work is, right? I mean,
Yeah.
all the time, even when we like our clients,
Hmm.
working with our clients, we like all our clients because I do believe that even when you're feeling like a dislike or a disapproval or some kind of judgment going on, they always have to come back to that point of empathy. Every person has a point of empathy, right?
Hmm.
So I'm sorry that I use that terminology, dislike, but enjoy, some we
Hmm.
enjoy a little bit more than others. So speaking of that, have you ever had a client that you thought we could be friends?
Yeah. Yes. Yeah, no, definitely. I mean, I can think of a few now, that, maybe they're similar age, even though I typically work with younger people, I do have a few that are kind of closer to my age, same personality, kind of, sarcastic, a little cynical, we like to do the same things, and I have to be careful sometimes because I can find myself, I'm a talker. You know how some therapists are just more listener. I talk.
Hmm.
And I will self-disclose if it's appropriate, if I find that it's helpful, but that's when I really have to be careful about, self-disclosing, and what I'm saying, what I'm sharing,
Hmm.
because yeah, sometimes you just want to tell them, or they feel comfortable to ask me personal questions like, where are you
Hmm.
going on vacation? What did you do
Hmm.
this weekend? And so it's trying to maintain those boundaries, but also really liking the person.
Yeah.
Yeah, I
Well, that's
know.
that's interesting because I'm not much of a self-disclosure. Definitely become a
Oh,
little bit more over the years because I was,
mhm.
trained psychoanalytically. So there's a lot of
Right.
that blankish slate for a long time. But I don't think the population has the tolerance for that anymore. And I enjoy the work much, much more when I'm really kind of in it.
Hmm.
But in it to me doesn't mean self-disclosing. But like I've worked with people, I remember many, many years ago, I worked with somebody who was in graduate school for social work. And actually, I think she came to me because I was her advisor at the school. And we worked together for years. And I felt like we were living parallel lives. Like the things that
Mm.
she was bringing up, of course, most people or aspects of what most people are dealing with have to do with relations.
Hmm.
And she was developing, a relationship with a boyfriend. She was dealing with a relationship with her mother, with her brother. She was dealing with self-doubt. She was then became, moved into private practice over the years. And it was just like, wow, we are, and she's
Yeah.
young. She was younger than me, but it didn't matter. We just kind of thought the same. And I often thought about, oh, I wonder what it would be like. Not that I would do it or, say, hey, even when the relationship ended, oh, we should stay in touch. I would never
Hmm.
do that. But there's somebody I'm also working with now who I've been working with for several years. And it's interesting because when I first started working with her, I was bored. She had such repressed emotions. She has now become a completely different person.
Wow.
And it's amazing. And she's so articulate about her feelings. And I just feel like we could have some really good, deep conversations. But the truth is, we're having them anyway as therapist and
Yeah.
client.
Yeah.
So, but it's just so it's very satisfying, very
Yeah.
satisfying.
Yeah. No, it definitely it can be. And I think those types of relationships, even though they're therapist client relationships, they almost feel, I don't want to say effortless, but they feel easier.
Yeah.
You're
Yeah.
not struggling to find what to say, or you even, you know, even internally, you feel like you're just connected with this person, and you
Yeah.
get, it's kind of like a warm and fuzzy feeling that you just really enjoy talking to them, almost like you
Yeah.
enjoy talking to a friend, but you
Yeah.
have to make sure you keep it professional, and
Of
you're
course.
not sharing too much, but that really makes the work so much
Hmm.
more enjoyable.
Hmm. I think a
You
lot of it has to do with what they bring, in regard to, again, for me, it's insight or self-reflect, the ability to self-reflect,
Mhm.
the willingness to do the work, the ability to hear what you do have to offer, right? That
Yeah,
some of these other clients
that they're
don't
really trying.
provide. Yeah,
Yeah,
yeah, they're
that they're
really
really trying.
trying.
Yeah.
Yes,
Yeah.
yes. Has anybody ever said anything outlandish to you, either probing with a question that's too personal or just something funny or,
Oh my
you know,
goodness.
yeah, that's hard to pull out of your hat.
I know it's hard to pull out of my head. I think, you know, I'm very open-minded and liberal with people. In fact, when I worked with teens, they often shared really crazy stuff that they did on the weekends, and they knew that it wouldn't phase me. Like
Mhm.
I never shamed them. I never was like, oh, you shouldn't do that. And so I do feel like that's a strength of mine in my work. It's like, so sometimes they just tell me really outlandish things, like
Oh, come on, give me an
just
example.
oh, I have one. I mean, I'm sure she would never, let's just say some interesting adult extracurricular activities for additional income.
Okay.
Let's just say that.
I
I'll
think
keep
we
it.
get that.
I think I can read between the lines there. But I personally was fascinated by it. I was like, that's so cool, and so I think she appreciated that there was no shock there. I didn't audibly gasp. So there's a lot of that. There's a lot of just telling me very personal sexual encounters, and just like nothing phases me.
Yeah, I think that's awesome. That's an important
So
trait, right?
yeah,
It's very important.
so for me, it's not, you know, I can't think of specific crazy things that someone has told me, but it's more of the level of really intimate details that they tell me that
Right.
I'm just totally okay with,
Right.
you
Right.
know,
Well, okay. So if you want a therapist who can, kind of jive with you in anything that you do or anything
anything.
that you say, seek out Ruthie.
Yeah,
But
anything. Nothing phases me.
as you were saying that, I was thinking, I can't remember, honestly, an outlandish thing, but I think about like when I read something, or even if a client does bring something, I sometimes think, is that so wrong?
Yeah.
Like, even if it's something that, might break the law, and I don't mean like hurting anybody or, or doing something experimental in some way, right? Like our
Hmm.
society is so judgmental and critical of that. And I think, oh, if somebody wants to, have sex for money, for example, what's wrong with that? Their
It's
body, their
right.
choice.
Right. Just
You
be
know?
safe about it. I've always
Right.
maintained, like, just be safe. Don't put yourself in harm, but
Right.
you do you,
Right.
especially when it comes to women. I've always supported women who want to experiment and want to be open sexually, like I mean, that's a whole nother topic. But,
Hmm.
I just think if a woman wants to express herself in sexually and enjoys it and is not putting herself in harm,
Right.
I'm their biggest cheerleader. I really am,
Okay.
you
All
know.
right. All right.
So I did have I sometimes I feel like I have to they catch me in a, like, they'll say something that I can just relate to on a personal level, or sometimes I, like, for example, I'm thinking of after the election, my first client Wednesday morning after the election, and I didn't realize the state that I was in, and I cried in the session. I couldn't get
Mhm.
words out, and that was really
Wow.
hard for me.
When
I
were they
felt,
talking about it, the election, or you
yes,
just were? Oh,
yes, they
okay.
were
Okay.
talking about it, and
Hmm.
and we both were crying,
Mm.
and I felt so, oh my God, this is like the biggest faux pas a therapist can do. Like, how could I let this happen? But it was actually very powerful. And she even thanked me at the end, and she's like, you really showed that your human side. And that made me feel so much better, because I was just like, oh my God, how could I let that happen? That
Right.
whole thing.
Right.
So, sometimes even those crazy moments, like, again, they can really be powerful and therapeutic.
Yeah. I mean, I assume you were tuned into her. There's nothing wrong with crying along with a client, but
Right.
if you become, more hysterical than them,
Right.
then we have a problem. And
Yeah.
then, they feel they have to emotionally hold you. And
Right.
that we
Right.
certainly don't want to convey. But
Right.
you met her where she was.
Right,
Nothing wrong
right,
with
right.
that.
Yeah.
Yeah.
And
Yeah.
she certainly wasn't, I wasn't, I was not inconsolable.
Yeah.
But it was just a human moment. I think sometimes there has to be room for human moments,
Of
because
course.
we're human, and we do tough work.
I think that's what we're trying to convey, right? That we
Mm-hmm.
are just people
Mm-hmm.
ourselves who were in therapy or still in therapy, and that we are
Yeah.
works in progress. along with our clients. Everybody continues to grow throughout their lifetime, and
Yeah.
we hope we're doing it in service to the clients that we see. And I think it's a great luxury to be able to grow professionally and personally as well, right?
Hmm.
In this career.
Yeah.
So yeah,
And
we go ahead.
I was going to say, and I encourage anyone, who's starting out or struggling, like, be in your own therapy. I can't tell you how many times my own work has mirrored the work that I do with clients, and I've learned so much, just learning about myself and learning about ways that I handle my own anxiety and my own emotions, like has helped me so many times in this work. And
Right.
so, like, I mean, I feel like a lot of us do our own therapy work, but
Hmm.
that has been so key, such an
Absolutely.
important piece.
Absolutely. And finding places to process what you're experiencing doing the work, whether that is in therapy or in
Mm-hmm.
supervision or peer supervision, where it's done professionally, respectfully to the clients and maintains the confidentiality of who
Mm-hmm.
you're working with, right? When we discuss our cases, we always disguise identifying information. We never use a first name or certainly a last name. And we're not doing it in a way that maybe, or I don't know if clients fear this, but we're not doing it in a way where, if you were gossiping about a friend or not a friend, hopefully you're not gossiping about a friend, but if
Right.
you're gossiping about somebody, we're doing it in a way that we're just trying to learn and serve the client in the best way as possible. And that includes talking about the feelings that we're experiencing when we're
Mm-hmm.
with the client, as we're kind of trying to show here. We don't want to turn anybody off to therapy.
Right.
We hope that our honesty, again, just helps people understand that the people that they're going to see have their own struggles as well.
Mm-hmm. Mm-hmm.
We are not, superheroes or super people. We are,
Robots.
or
Yeah.
robots. Yeah,
Yeah.
we're really just one of you.
Mm-hmm. Yeah. And that's often sometimes something I say to people too. It's like, I'm not immune from anxiety.
Hmm.
Just because I
Hmm.
this is my field doesn't mean that I don't struggle with it too. And but these are the things that I've tried, and these are there's hope, there's a way out. But I think to humanize, to recognize that you are human and that you're not a
Hmm.
machine and that you have emotions, and you like some clients better than others, all of that is just
Hmm.
so normal, and I think it is really important to normalize it.
Yeah, and I think that it's important. I'm going to go a step further and say I think that most people go into this profession because we know pain personally. We know
Mm-hmm.
pain, and we are able to use our pain in service to other people to really be able to empathize, to understand, to want to explore and get to know what your pains are and how you can best overcome
Mm-hmm.
them.
Yeah.
Or is it overcome is the correct word? Or manage it and live
Yeah,
with it.
past it, live it.
Get
I think all of
past
the
it.
above. I
Right.
think it all works.
Right.
You
You have to go
know,
through it to get past it,
have
right?
to. You have to. Yeah.
Ruthie,
And you
thanks so
learn from it.
much. Yeah, this was so awesome and fun.
Yes.
Fun. Fun for me.
Yes.
Thanks. If you guys want to learn more about Ruthie, check out her website, ruthiekalai.com, RUTHIEKALAI.com. And I'll also put that in the episode description. Ruthie, maybe we can do it again.
Okay, Amy, definitely. Anytime.
All right.